Coming to question number 6. You were a first-year pediatric resident presenting a case about metabolic disorders. Your senior doctor questioned which of the following metabolic disorders clinical features are seen due to accumulation of toxic compounds. So which IEM? The features are due to toxic compound accumulation. Phenylketonuria, yes, it is due to accumulation of phenylalanine. The mental retardation is produced by increased phenylalanine. The musty odor, etc. All these things are due to derivatives of the phenylacetate and acetate, etc. So phenylketonuria clinical features will be due to toxic compounds. Mental retardation, CNS features will be due to accumulation of phenylalanine. So increased phenylalanine will produce MR, and so phenylketonuria will be one such option. MSUD, again similar, it is due to accumulation of toxic compounds. Same for urea cycle defects, particularly if ammonia is getting accumulated. Regarding mitochondrial disorder, it is not accumulation of toxic compound, it is impaired energy genesis, impaired respiratory chain function, which is responsible for majority of problems in the patient. So it is not a toxic compound accumulation. Yes, acidosis can develop, lactic acidosis can develop mitochondrial disorder, but the tissue injury, the damage in the patient is happening because of impaired dysregulation, impaired regulation of the mitochondrial enzymes, and not because of some specific toxic substrate getting accumulated, right? And so the answer to this question is 1, 2 and 3. So option A will be the correct answer. So impaired respiratory chain or impaired energy function of the cell is responsible for all the defects in mitochondrial disorders. Classically, it is not considered to be a toxic material accumulation related IEM. It used to be old classification, but this question is somehow related to that particular pathophysiological aspect.
Subscribe and press the bell icon so you never miss an update from PrepLadder.